Why do you wake up so often at night? A doctor's guide to natural solutions for frequent nighttime urination. Have you ever found yourself waking up multiple times during the night, feeling the urge to urinate, only to struggle to get back to sleep? If so, you're not alone. Many older adults experience this frustrating issue, known as nocturia, and it can take a serious toll on both your sleep and overall health. As a doctor with 2 decades of experience treating elderly patients, I can tell you that this isn't just an inconvenience. It's a signal from your body that something needs attention. Now, before you assume that waking up at night is just a part of aging that you have to accept, let me assure you, there are real, natural solutions that can help. While medication is an option, many patients prefer to start with simple lifestyle adjustments, dietary changes, and a better understanding of what's really going on inside their bodies. That's exactly what we're going to cover today. Don't forget to hit the subscribe button and turn on notifications so you never miss out on essential health tips. If you have any questions, feel free to leave a comment below. What causes frequent nighttime urination in older adults? To understand why you're waking up so often, let's first look at what happens inside your body. The bladder is a remarkable organ designed to store urine until it's convenient for you to release it. But as we age, changes in the bladder's function, nervous system activity, and even heart circulation can make nighttime urination more frequent. One major factor is that your bladder's capacity naturally decreases over time. This means it fills up more quickly, triggering the urge to urinate sooner than it used to. At the same time, the communication between your brain and bladder can become less efficient, making it harder for you to hold it in until morning. Another key player in this puzzle is your body's fluid regulation. During the day, gravity keeps excess fluid in your lower limbs, which is why some people experience swelling in their legs. But when you lie down at night, this fluid is reabsorbed into your bloodstream and eventually processed by your kidneys, leading to increased urine production. This explains why you may not urinate much during the day, but suddenly feel the need multiple times at night. For men, an enlarged prostate is often to blame. As the prostate grows, it can press against the bladder, creating the sensation of needing to urinate even when the bladder isn't full. Women, on the other hand, may experience similar issues due to weakened pelvic floor muscles after childbirth or menopause. And let's not forget the role of certain medical conditions. Diabetes, heart disease, and even sleep disorders like sleep apnea can all contribute to nocturia. When your body struggles to manage blood sugar or fluid levels efficiently, your kidneys compensate by producing more urine, especially at night. Now that we understand the causes, let's move on to the part you've been waiting for, the solutions. How can you naturally reduce the number of times you wake up to urinate? Natural solutions to reduce frequent nighttime urination. If you're waking up multiple times at night to urinate, you might be wondering, can this really be fixed without medication? The answer is yes, in many cases. The key is to address the underlying causes, and that starts with simple but effective changes in diet, lifestyle, and daily habits. 1. The right way to hydrate. When and how you drink water matters. Many people assume they should simply drink less water in the evening to avoid nocturia. While this sounds logical, it's actually not the best approach. Dehydration can make your urine more concentrated, irritating the bladder and making you feel like you need to go even more often. The key is to hydrate smartly. Drink most of your fluids earlier in the day and gradually reduce intake in the evening. Aim to stop drinking large amounts of liquid at least 2 hours before bedtime, but make sure you're still getting enough water throughout the day. If you're thirsty at night, take small sips rather than gulping down a full glass. One often overlooked trick? Limit caffeine and alcohol, especially in the evening. Both are diuretics, meaning they make your body produce more urine. If you enjoy a cup of tea at night, opt for caffeine-free herbal teas like chamomile instead of black or green tea. 2. The role of diet. What you eat affects your bladder. Your diet plays a significant role in how often you wake up at night. Some foods can irritate the bladder and worsen nocturia, while others can help strengthen bladder function and reduce inflammation. Foods to avoid. Spicy foods, acidic fruits like oranges and tomatoes, artificial sweeteners, and carbonated drinks are all known to trigger bladder irritation. Reducing these in your diet can make a big difference. Foods that help. If you want to support bladder health, focus on magnesium-rich foods like bananas, avocados, and leafy greens. Magnesium helps relax bladder muscles, reducing the urgency to urinate. Omega-3 fatty acids from fish like salmon or walnuts can also help lower inflammation, supporting overall urinary health. One particularly effective food? Pumpkin seeds. These are rich in zinc and antioxidants, which help strengthen the bladder and reduce overactivity. Studies have shown that pumpkin seed extract can significantly improve urinary control in both men and women. 3. Simple lifestyle changes that make a big difference. Beyond diet, small daily habits can have a powerful impact on nocturia. One of the most effective changes is to elevate your legs for about 30 minutes before bed. This helps redistribute fluids that accumulate in your lower limbs throughout the day, preventing excess nighttime urine production. Regular movement during the day is also crucial. Light exercise like walking, stretching, or yoga improves circulation and helps your body process fluids more efficiently, reducing nighttime urination. If you spend a lot of time sitting during the day, try standing up and moving around every hour. It's also worth looking at your sleep routine. Poor sleep quality can increase nighttime awakenings, making you more likely to notice and respond to the urge to urinate. A relaxing bedtime routine, such as reading, deep breathing, or gentle stretching, can help you sleep more deeply and minimize unnecessary awakenings. 4. Strengthening the bladder. The best exercises for better control. One of the most effective long-term solutions for nocturia is bladder training and pelvic floor exercises. When done consistently, these techniques can help you regain better bladder control and reduce frequent urges. Bladder training. This technique involves gradually increasing the time between urination. Start by delaying your trip to the bathroom by 5 to 10 minutes when you feel the urge, and slowly extend this time over a few weeks. This retrains your bladder to hold more urine without overreacting. Pelvic floor exercises, Kegels. For both men and women, strong pelvic muscles provide better control over the bladder. To perform Kegel exercises, contract the muscles you would use to stop urinating. Hold for 5 seconds, and then relax. Repeat this 10 to 15 times, 3 times a day. Over time, this can significantly reduce urinary urgency and leakage. Leg and core strengthening. Gentle core exercises, such as bridges, squats, or gentle yoga poses, can improve bladder support and stability. A strong core means less pressure on your bladder, reducing frequent urges. When should you see a doctor? Signs you shouldn't ignore. While frequent nighttime urination is often a manageable issue, there are times when it signals something more serious. Many people assume that nocturia is just a normal part of aging, but if it starts suddenly, worsens rapidly, or is accompanied by other symptoms, it's essential to seek medical advice. One red flag is pain or burning during urination, which could indicate a urinary tract infection, UTI. If you notice blood in your urine, even if it's just a small amount, don't ignore it. This could be a sign of kidney stones, bladder infections, or in rare cases, something more serious like bladder cancer. Another important symptom to watch for is unexplained swelling in your legs, ankles, or feet. This could mean your body is retaining fluid due to heart or kidney problems, which can contribute to increased nighttime urination. If you're also feeling unusually tired, short of breath, or dizzy, consult a doctor as soon as possible. Men with nocturia should be particularly mindful of difficulty starting urination, a weak stream, or the feeling of incomplete emptying. These symptoms suggest an enlarged prostate, a common issue that can worsen over time if left untreated. Finally, if your nocturia is severely affecting your sleep, making you feel exhausted during the day, or leading to falls due to frequent nighttime trips to the bathroom, it's worth getting checked out. Poor sleep quality can impact everything from memory to heart health, so addressing the underlying cause is crucial. Putting it all together, a doctor's final advice. By now, you have a clearer understanding of why nighttime urination happens and what you can do about it. The good news is that, for most people, simple changes in hydration, diet, exercise, and bladder training can bring noticeable relief. But consistency is key. These aren't quick fixes, but long-term strategies that support your body's natural balance. If you struggle with frequent urination at night, I encourage you to start with small, manageable steps. Pay attention to what you drink and when. Adjust your diet to support bladder health. Make light movement a part of your daily routine. Try bladder training and pelvic floor exercises. And most importantly, listen to your body. If symptoms persist despite these changes, don't hesitate to talk to a doctor. The sooner you address the root cause, the sooner you can regain restful, uninterrupted sleep. So tonight, as you prepare for bed, remember, you have more control over your bladder health than you might think. A few mindful adjustments today can lead to better nights and healthier mornings ahead. If you found this video helpful, please hit the like button. It really helps us bring you more valuable content. Drop a comment below to share your thoughts, ask questions, or let us know what topics you'd like us to cover next. We love hearing from you. And of course, don't forget to hit the subscribe button and turn on notifications so you never miss out on our latest health tips and insights. Stay informed, stay healthy, and we'll see you in the next video.